Here now is the question, which one is superior for diagnosis, clinic blood pressure monitoring or home blood pressure monitoring? Now here I have to tell you some important points. One is because of the COVID, a lot of things have changed in our life. Even the way we are practicing, that has been changed as well. A lot of us are doing online consultation, remote consultation, and where home BP monitoring is taking upper hand than clinic BP monitoring. But on the other hand, the evidence, what the evidence is showing, which is better. Now, home BP monitoring is superior to clinic BP monitoring. Why? Because importantly, that it is more reproducible and it just showing that it can predict the future cardiac events more than clinic BP monitoring. Because there are a lot of other factors which can influence the clinic BP, as I've already mentioned. So among this home BP monitoring and ambulatory BP monitoring, where you are fixing one machine to the patient and allowing the patient to go home, just ask them to do what they're normally doing. Sometimes if you don't tell them this specifically what they do, they just go home and lie down. So that's what we don't want. If they want to go to the office, let them go to the office, because we want to check the BP in their normal situation. So ambulatory BP monitoring is the gold standard in diagnosing hypertension. But sometimes all of us don't have the facility. We are working in different places, different setups, in different financial constraints are there. So home BP monitoring is a good alternative. If patient can afford, in this COVID era, if you ask them to buy few things like this BP machine, this pulse oximeter, and if a diabetic patient is around, if you ask them to get a glucometer, that would be a good investment from the patient's point of view. So added advantage of home BP monitoring is to pick up white coat hypertension. That term is, we all know that when the clinic BP is higher than the home blood pressure, and we assume the patients are very anxious, even they have a very good relationship with you, but just with the name of coming to the clinic, their blood pressure goes up. But there is a term called masked hypertension, where the reverse happens, where patient says that whenever I check the blood pressure at home, it is high, and when I come to the clinic, it shows normal. It's very interesting. Why it happens, there is a lot of explanation, but there is no scope for so much of discussion. But what I want to tell you here, that sometimes what happens when patient says like that, we say, no, your machine is faulty, throw the machine away and get another machine. So what we should suggest them, that get it checked with another machine, or ask your local compounder or nurse practitioner, whoever is there, to come and get it checked once. And if both the readings are showing the same, that means the machine is not faulty, or your home BP may be high. So masked hypertension is something new, maybe you are hearing. But in blood pressure management, what I find that most challenging thing is patient education. Everybody will tell me that we don't have time. Yes, I agree. But say when you are diagnosing the patient with these chronic diseases like hypertension, like blood sugar, like asthma, one session you have to go with them thoroughly so that they understand. Sometimes we write the medicines and say review in 2 months. And what happened, these patients, they take the medicine for 2 months and they see their blood pressure is good. They stop the medicine. They don't want to come to the doctor again with the idea, number one, I'm cured. Number two, the doctor will again start on something else. So for that reason, you have to explain that this is not the disease we can cure, we only can control. And for that reason, you have to come to me. Why? Because perhaps you are not having any problem now, but in future, you can have 4 major organs can get affected: kidney, eye, brain, and heart, and they really are scared of kidney failure. So if you use this word, that kidney problem can happen with blood pressure, or you can have a heart attack or stroke, that is the time they might think it is serious and they might need to come back if you start them on a blood pressure medicine. And engaging, how you are engaging with your patients, that will determine the outcome of your treatment.